chronic GI upset dog. This is an on and off diarrhea with the following hallmarks. Seems to be fine when on medicine. But as soon as the dog goes off, it's back. If we give anything out of the ordinary, it triggers diarrhea. She never had this before. Insert date. Mostly diarrhea rather than vomiting. The dogs act fine when they go through the spells of diarrhea. Only occasionally vomiting. Various causes and contributors to be ruled out. Giardia tops the list. A fecal exam and some metronidazole are effective. Giardia shows up on fecals less than half of the time. Hookworms in very young or rather old dogs. Empirical deworming, a fecal exam, or being on heart guard are effective. Coccidia in younger dogs under 2 years old. Alban sulfa are effective. And fecal exams may reveal it. Often not though. Inflammatory bowel disease can be temporary or permanent. Sulfasalazine therapy can aid the diagnosis. Cancer is possible but in most cases is unlikely. In desperation, endoscopy, radiology, CT scan, MRI, and maybe pinch biopsy are useful but extremely expensive diagnostics for hopeless outcomes. So, why? Various controls for active diarrhea. Phenobarbital can slow the gut. Phenobarbital can save lives if the diarrhea is peeling through a dog's hydration badly. Phenobarbital would be used for watery diarrhea of more than 24 hours duration. And mainly if it's not responding to other modalities. Sulfasalazine can be tried, and the results should be closely noted, even written down. There is no reason to try sulfasalazine if you don't gather the information about how she did on it during the administration. Steroids to illuminate IBD are risky in diarrhea but can be effective in inflammatory colitis. In my hands, sulfasalazine needs to be shown to help before daring to use a steroid in a bowel case. For watery diarrhea, DMSO can be given under the skin properly diluted, especially if the diarrhea has gone to soup, water, jelly, and absolutely has to be curbed pronto. DMSO dilutions for or SC are great in long-term diarrhea where nothing has worked so far. DMSO given undiluted under the skin feels like a murder hornet and a killer bee had a baby. And 4 of those stung you. So don't use it undiluted. Tums tablets have the effect of forming up and drying out stools. Tums reduces excess stomach acid which can be a contributor to colitis. So Tums would be 1 or 2 tablets of berry flavored per 20 pounds once or twice a day. It's indisputably helpful, but cured nobody's dog. Digestive enzymes such as prozyme are sometimes amazingly helpful. Sometimes young dogs never had enough enzymes. And sometimes later in life their enzyme production declines. Without enough enzymes, the dog digests food poorly. And then, whole undigested proteins make it to the colon and create an inflammatory response. Then it's called inflammatory bowel disease, which is amazingly controlled with prozyme. There is an age and condition where pancreatitis should be ruled out. All cases demand stringent attention to monotony in the diet. The food should be dry. The treats, none. Or we pre-agree on what they are. And what the treats aren't. These dogs should never be encouraged to eat because they can feel diarrhea coming on ahead of the event, and won't be hungry the day before that happens. Let it be. Of all the things the owner should remember, 99% of these type cases are very sensitive to fat. Any little bite of fat in the diet can trigger explosive results. Thank you for your attention.
Hey, thank you for watching the video. I really appreciate that. Hope you learned something. That's the entire intent of these videos, is to be helpful. Just a real quick favor to ask of you. Would you mind sharing this video with one person? I would appreciate it. One person that you think might benefit from knowing better nutrition for their dog, from somebody that doesn't sell dog food. Anybody who could benefit from just taking better care of their pets. Share, like, subscribe, help me get my voice out. I would appreciate it very much. Thank you so much.